and life after dental school. So the transition from dental school in Australia to practicing in Canada is smooth and easy. At Sydney Uni, the school organizes for you to write the Canadian board exams during your final exams. This way you get to study for everything at the same time. You're not worried about sitting exams when you move back. Things may have changed since I graduated, but from when we finished exams until graduation, there were about 4 months. At that time, you couldn't practice without your degree until you crossed the stage, at least in Canada. So a lot of our friends stayed back, worked in Australia right away, or traveled. I would definitely recommend making the most of this time. It's going to be the last long break you have before you start your career. And then in that time, you still can secure a job and have it lined up for when you are registered. I applied for jobs through BCDA, which is our dental association in BC, as well as job sites and word of mouth. Just talking to people and kind of finding out is kind of sometimes the best way to find a job. Ultimately, I chose a job that was listed on the BCDA website. My first office had 7 ops, multiple dentists that worked at the same time with many hygienists. It was a part of a dental corporation, meaning it's owned by a group that owns many dental offices. The biggest benefit to this type of setting for your first job is just being able to discuss cases with colleagues. Similar to dental school, you have lots of people to bounce ideas off of and kind of just help and support each other when you get stuck on difficult cases or you just need kind of someone to help you plan. And you also have a huge access to different resources. In 2019, I also received an opportunity to teach at UBC in their clinical dentistry department. I wanted to get some experience on a different side of dentistry and experience what the Canadian dental school programs were like. My position was as an associate professor in second-year clinics, so I helped students create treatment plans and supervised while they executed treatments for the first time. My position was a couple hours once a week, but there are more involved positions in the faculty if that is something you're interested in once you graduate. And here's just me doing a couple different treatments. This is me administering Botox, and the second picture is just doing some pediatric dentistry. You can see that you kind of have to move around and do things a little differently when you have the little ones in the clinic. And this is one of my assistants just doing an Invisalign scan for some ortho treatment there. And this is my current office after 4 years at my previous office. When my boss sold her share of the practice, I decided to move on. So I was in Kits for the first few years. And the last year and a half, I've been out in Cloverdale. This is a big change for me as I was always in a big office setting and in the city setting. But my current office is 5 operatories, but there's only 2 dentists at this one. I only work 3 to 4 days a week now, just because it works a little bit better for my lifestyle. I used to work 5 days and plus teach a 6 day. So, you can kind of always change things as your career progresses. I do have the opportunity to work more often if it suits me. And whenever the dentist that I work with goes on holiday, I work full time and vice versa when I'm away. I do like the flexibility of being in a smaller private practice. I can take more time off. My brother and his little family live in England, so I do like to go visit my nephews over there very often. But both of us dentists are always trying to learn new things and take courses. And he actually went to school in Australia as well. He was at JCU, which is one of the undergrad programs.